Hello, everyone. Thank you for joining CASW's webinar. My name is Roshni Kurian, and I am the Education Coordinator here at the Canadian Association of Social Workers. Thank you all for joining us for today's session on an introduction to the Canadian Research Network on Transitions to Adulthood from Care, otherwise known as CANTRAC, and Care Leaving in Canada. Before we begin, I would first like to acknowledge that the CASW is situated on the unceded and unsurrendered territory of the Algonquin and Anishinaabe peoples. First Nations, Inuit, and Métis Nations have been stewards of Turtle Island since time immemorial. We also remember those who were forced to come here, particularly those brought here because of the transatlantic slave trade and slavery. We recognize our complicity in settler colonial violence, and we honor our commitments to truth and repairing relationships. We welcome you to take a moment to reflect on the territories that you are tuning in from and the many nations and peoples who have cared for this land. Before passing the podium on to our presenters, I will quickly go through some housekeeping formalities. Today's event will be 1 hour, and towards the end of the presentation, we will address questions from the audience. Each of the widgets on your screen are adjustable in size and movable, so you can arrange your screen to suit your preferences. Live closed captioning in English and French is now available on the platform under the media player widget. I encourage you to type your questions in the Q&A box at any time during the presentation, and we will do our best to address them at the end of the presentation. The recording of this event will be available in 24 hours using the link that you signed up with. A certificate of attendance will be emailed to you at the end of the presentation, or you can download it directly from this platform at the end of the event. And lastly, please be sure to fill out the survey that will appear at the end of the session. Thank you so much for your time and attention and for being here today. And I will now pass it on to the CANTRAC team to introduce themselves.
Hi everyone, welcome to the first webinar of a series of 5 webinars sponsored by the Child Welfare League of Canada, the Canadian Association of Social Workers, and CANTRAC, which is the Canadian chapter of INTRAC, the International Research Network on Transitions to Adulthood from Care. Before we begin this webinar, we wanted to acknowledge that we are joining you today from Teotihuacan, known today as Montreal, which is located on the traditional and unceded territory of the Kanien'kehá:ka Nation, who have been caring for the land and its people for time immemorial. The territory is now home to many diverse First Nations, Inuit, and Métis peoples. While we are joining this event virtually, it is important for each of us to reflect and confront our own place on the land we are situated on and on which we are able to engage in this work, whether that be treaty territory or unceded and stolen lands, its history, and how we can contribute to decolonization. Indigenous peoples have been significantly impacted by the colonial and assimilative policies and practices on the mainstream Canadian child welfare system, a system in which Indigenous children and youth are overrepresented. In working towards a better future for all youth in and from care, we must each recognize our role and responsibility in addressing colonial harms against Indigenous peoples and work to uphold their sovereignty and rights. So today, this webinar series is intended to introduce you to the Canadian research on care leaving and will be presented by members of CANTRAC. This first webinar today will focus on the introduction of INTRAC, the International Research Network on Transitions to Adulthood from Care, and CANTRAC, the Canadian chapter of INTRAC. The next webinar will focus on a model for engaging care leavers in community-based research. The third one will talk about a collaborative photo voice research project with young people who have aged out of care and experienced homelessness. The fourth webinar will focus on agentivity challenges among young women who have aged out of care. And the last one will be presenting emerging scholar research on the experiences of young people exiting the Canadian child welfare system and the care leaving process. We thought about this webinar series because it's very important to share research in this field with practitioners and policymakers. Research across the globe on care leaving has helped to better understand the process of leaving care. It has also led to the development and implementation of initiatives to better prepare and support youth when they age out of the care system. It has played a key role in highlighting support needs for youth in and out of care, and it has also guided policy and legislation regarding care leavers. So today I'll be co-presenting and facilitating this first webinar. My name is Laurence Magnan-Tremblay. I'm a PhD candidate in psychoeducation at the University of Sherbrooke in the province of Quebec. My work focuses on the coping process of care leavers while they transition into adulthood. I also represent the Canadian student members of INTRAC, and today I'll co-present this webinar with Varda Manfeder and Mélanie Doucet. Varda is a professor of applied human sciences at Concordia University. She also represents the Canadian researchers of INTRAC, and Mélanie is an adjunct professor at the McGill University School of Social Work. So maybe Varda and Mélanie, would you please introduce yourself? Varda, maybe you can go first. I see you put up your camera, and maybe Mélanie could go after you so she could talk a little bit more about her work too.
Thank you, Laurence, and hello, everybody. As Laurence mentioned, I'm currently a professor in Montreal at Concordia University, but I spent 30 years working in the child welfare system as a psychologist, where I was involved directly in programs of intervention for youth leaving care. That grew into my program of research, in which I investigated I compared actually leaving care to the experiences of young people leaving home. And now I focus a lot of my efforts on advocacy. So that's me.
And I'm Dr. Mélanie Doucet. Like Laurence mentioned, I'm an adjunct professor at the McGill School of Social Work. I'm also a consultant, and I'm currently leading a project with the support of the Child Welfare League of Canada on equitable transitions to adulthood for youth in care. And I'm a former youth in care myself. I was in care as a teenager in New Brunswick, which is where I'm originally from. So the work that I do is very much driven from a life experience perspective, and I tend to focus projects and research projects on lived experience centered approaches. So I do a lot of collaborative arts-based type of research, which I'll be presenting later on in this series. I think I'm session 3 later in October. And yeah, a lot of the work that I do is really all about advocacy as well, and advocating for meaningful systemic change in the mainstream child welfare system. So that's me in a nutshell.
Thank you to both of you. What's this first webinar about? In the first part of the webinar, we will introduce you to INTRAC and CANTRAC. The second part of the webinar will focus on the status of leaving care in Canada, how Canada fares in the international context, and the regional disparities and post-majority supports across the country. And we will also talk about significant proposals for solutions. So what is CANTRAC about? CANTRAC is a well-established academic research network that brings together over 300 academic researchers from 48 countries across the globe. Initially, INTRAC was born out of international collaborations between the UK, Israel, the US, and selected European countries that began in 2003. In 2005, at a workshop in Brussels, the name was adopted, as was the intent to sponsor regular meetings to promote international dialogue and comparative research. So INTRAC promotes collaboration and dissemination of research findings, but also advocacy for youth leaving care across the world. INTRAC activities include annual meetings. These meetings are a rich source of networking, discussion, and presentations on the newest international work and result in many opportunities for international collaboration in service of advancing the rights and entitlements of young people who have grown up in substitute care. INTRAC has also a special subgroup called CORIT, which means Community of Researchers in Transition. It comprises master's and doctoral students who and those who graduated within the past 3 years. So the CORIT group aims at collaborate and connect in a number of ways. Group members have presented in international conferences, collaborated on publication, and participated in workshops on relevant topics. Each country has also an elected postgraduate student and a researcher representative. In the case of Canada, that is Varda and I. Now, what is CANTRAC? CANTRAC is the Canadian chapter of INTRAC. As you may know, approximately 6,000 young people age out of care each year in Canada. So this has brought together over more than 40 researchers and postgraduate students around care living research. Lately, CANTRAC activities have included online discussions to talk about our research, the publication of a special issue on the transitions to adulthood from care, but also activities such as this webinar series. More recently, our activities have also included reaching out to other researchers that are not members of CANTRAC nor INTRAC, because we came across their work on youth living care in Canada. So there is a real potential for our CANTRAC community to get larger. Now for the next part of the webinar, Varda will talk to you about the status of care living in Canada.
Okay, thank you, Laurence. Well, in Canada, and Laurence already mentioned that 6,000, and some estimates are that it's closer to 7,000 young people age out of care every year in Canada. We know that they take on adult responsibilities much earlier than the average Canadian. I'm going to talk to you a bit about that soon. They have far less supports in the transition to adulthood than other Canadians. And in fact, they suffer adverse consequences as a result. I want to really stress to you that the suffering and difficulties that young people, care experienced young people in Canada face really are related to systemic problems. These are young people with tremendous potential who end up being stigmatized and also deprived of adequate supports in the transition to adulthood, largely because of the accident of their birth. That is, the accident by which they were born into a given family, a given social network, and even the province that they were born in. And we're going to talk about inequities across Canada as we go through this presentation. So here's some data about the realities of youth aging out in Canada. Well, we know that over half of young Canadians aged 20 to 24 still live with their parents. Many, a very large percentage, don't finally leave home and successfully launch themselves till they're almost 30. So even if they leave at 20, they come back several times. We know about this phenomenon of the boomerang generation, right? Youth in care, on the other hand, abruptly lose support because everywhere in Canada, they're subject to age-based cutoffs. That means they have to leave to go out on their own, not based on their own readiness, but based on some arbitrary decision about at what age a person should leave. This propels many young people from care into a life of instability and insecurity. This includes facing homelessness and housing insecurity, poverty, mental health, and issues with addictions, unemployment, undereducation, involvement in the criminal justice system. Recently, scholars in the homelessness sector associated with Away Home Canada, which is a large national organization that deals with homelessness, stated that if you have been in care, you're 200 times more likely than other Canadian young people to experience homelessness. And then the last statement here. Most youth leaving care start their adulthood living below the poverty line, with nearly half relying on income assistance. This is because of lack of appropriate entitlements. This is not the case in other countries, as I'm going to explain to you shortly. So again, this is because the government of Canada and provincial governments who have the responsibility to parent these young adults are doing an inadequate job. It turns out difficulties facing youth leaving care really have come to light. National problem. Some countries deal with it much better than others, as you'll see. But that's why INTRAC and CANTRAC have been so important in relation to this problem. And Laurence mentioned the critical importance of research collaboration. Also, there are more and more international efforts to engage in advocacy as a research community. And the thing I'm going to tell you about now is that we really have discovered, I really have discovered as the person representing Canada at INTRAC, where Canada stands in relation to the rest of the world. And I just want to start off by telling you the punchline here. We are one of the richest countries in the world, and we have one of the weakest safety nets for young people who've experienced placement and youth protection involvement. So this is a shameful reality that I face when I go to meetings, because people often want to hear from Canada. They have the expectation that Canada is a progressive nation that has many resources. And in fact, many less developed countries, countries in the global south, are doing much better than we're doing. So where does Canada stand? And I purposefully chose here a picture. It's about 10 years old. It's from a garbage bag fashion show that was sponsored by Youth in Care Network, which is an organization of former young people from care in Winnipeg, to highlight the fact that many young people in Canada at that time were leaving care at the age of majority with little more than a garbage bag to put their belongings in. And I just want to say that in some parts of the country, this is still a reality. We still have young people in Canada leaving care with nothing but a garbage bag. It's terrible. Whoop, here we go. So there's a typo on this slide, so I apologize right away. Where it says 2020, it should really say 20. Sorry, it does say 2020. Look, Melanie, you fixed it. Thank you. Sorry. This is a slide from 2020. It's from a study that I was privileged to be involved in with 3 INTRAC colleagues, 2 from Germany and 1 from South Africa. And this is part of a movement to create more and more comparative research on what's going on in child welfare around the world, what's going on with youth leaving care in the world. And so I'm showing you results of a study that basically was conducted between 2018 and 2019. I'm also involved in a forthcoming edited volume that's going to come out from Oxford Press in the new year that involves 30 of these participating countries. And there has been some movement since 2018, but not a whole lot. And so this shows you the 36 countries that participated in this study. And you'll notice it's scattered all over the world. Some of these countries are very rich countries, others are very poor countries. But we were able to circulate a survey to key informants to find out more about the status of their child welfare system, but also especially their care leaving situation. And this was published in the Journal of International and Comparative Social Policy in 2020. So I'm going to just share some highlights of this research with you. The first thing I want to show you, animations. Okay. Sorry. I might need the assistance of one of my, oh, thank you. Laurence, are you assisting me here?
Do you want them all or just one at a time?
Yeah, please, actually. I didn't realize, sorry, despite myself. Sorry.
There you go.
Thank you so much. Okay, perfect. Thank you. So one of the things we wanted to find out is, do care leavers, and that's the phrase that INTRAC uses to cover all care experienced young people. It's a bit unfortunate as a title, but that's how they're referred to, and they're often referred to in the literature as care leavers. So in this slide, it shows you across these 36 countries, what were the challenges that young people from care were facing in 2018. You can see that there's a very high rate of agreement across all these countries in relation to these problems. And so employment was the number one challenge that young people from care were facing at that time. Education, housing, poverty, and you can read the list, and many of the things I've already mentioned. One of the things I want to stress here is that Canada, young people leaving care in Canada face all of these problems. So yeah, we're not doing very well. Next, I think I'm going to have the same problem, Laurence, if you can assist me here.
There you go.
Thank you. Wonderful. Thank you. Next, we wanted to look at what are the supports that are available to young people who leave care across the world. What you can see here is that nearly less than half of the countries, only 15 out of 36, only support young people leaving care up to age 18. There are parts of Canada where this is still the case. Where we are in Quebec, there are no legislated supports after the age of 18. And that's not unique to Quebec. But what you can see here is that over half the countries in this survey had support for young people to a much later age. In fact, a significant percentage of the countries provide support, legislated support, from 21 up. And there are even countries, 7 countries in this sample, where young people get support between the ages of 25 and 27. So again, we're not doing very well. In terms of legislation, thank you. Thank you, Laurence. There we go. In terms of legislation, okay, 32 of the 36 countries have child welfare legislation. So there were countries in this sample that didn't even have child welfare legislation. 23 of the countries had well-developed child welfare legislation. And of the 36 countries, 17 have aftercare legislation. And one thing that's become very clear to me as someone involved in this kind of comparative research is there is an alignment between the amount of support that's available to these young people and the existence of legislation. So many of the countries in INTRAC have child welfare legislation. Only about half had, by 2019, had legislation on aftercare, so provisions for young people when they leave care. This is changing, I'm very happy to say. So for example, I'm going to be at an INTRAC meeting next week in Argentina, and they have fantastic new national legislation on aftercare. Now, the other problem, and it doesn't show up in that chart so much, is that if you break down the countries that do not have aftercare legislation, most of them are in the global south. What does that mean? When we talk about the global north and the global south, we used to talk about the developed world, the underdeveloped world. The global south are the poorer countries that have where there have tended to be slower developments around social services, around the provision of care. It turns out that when you look only at countries in the global north, which are the richest countries, okay, Only 6 countries in this study from the global north had no aftercare legislation. And guess what? Canada is one of those countries. We don't have a national framework in Canada, nor do we have any kind of oversight for child welfare. And specifically, we have no statement of any kind in our national legislation about the rights of young people to aftercare. And this is a problem because without legislation, as I mentioned to you before, in Quebec, for example, there are very few entitlements after age 18. There are other provinces where things are a bit better, but what we have in Canada is a patchwork of provisions because there is no legislated frameworks. So I'm going to show you this. In Canada, the entitlements, and when I talk about entitlements, what I'm really talking about is when young people grow up in care and leave care to live on their own and they have no family support. Okay, and we know a lot of young people leave care to go home to family. But when we talk about care leavers, we're talking about people without that kind of support. They have no safety net. And so what has gone on in parts of Canada and in the rest of the world is that governments have legislated that young people without family support should be provided with support by the government. And they phrase these as entitlements. That is, there is a clear indication that these young people have the right to this support. So in Canada, entitlements here range tremendously. So there are some places, I mentioned Quebec, where there's nothing once you attain the age of majority. There are other parts of the country where you get financial support and services until age 26. The same is true in other parts of the world through legislation. For example, in the UK, young people are entitled to stay in placement beyond the age of majority. There's no age cutoff. In Canada, there's extended care in 5 regions only. There's some limited support after leaving care in all regions, and mostly it has to do with money, so people can get financial support. Never enough, by the way, to have a reasonable standard of life. However, all jurisdictions in Canada impose very narrow eligibility requirements for both. So typically, young people leaving care who are in school are entitled to more support than other young people. And we know that a very high percentage of young people from care do not stay in school. So it becomes virtually impossible for young people on the whole to really avail themselves of these entitlements, which presumably they have a right to, and they have a right to expect from the government, which is their parent. So now I'm going to hand it over to Melanie.
Thank you, Varda, for setting the stage for this part of the presentation. So I want to go in a little bit more detail of what currently exists in terms of post-majority supports throughout the country. So this is a map that's taken from the Child Welfare League of Canada's website. We have a blog post on there that links to all those existing programs and supports. So here you'll notice that BC, Manitoba, Saskatchewan, Ontario, Quebec, New Brunswick, Nova Scotia, and PEI have some form of supports in place. I will mention that the one in Quebec is very general to all youth. It's called the Programme Qualification Jeune, and it's not specific to the youth in care community. It can be accessed, but again, places are limited. It's limited to certain regions as well. And there's restrictive eligibility criteria for this program. So a lot of youth leaving care don't get to access it. So all of these programs actually have eligibility criteria attached. So it can vary from, well, they all have age cutoffs. So for example, the one in BC, SAGE program is what they're calling it right now. It's up to age 26. The grant and supports to young adults program in Alberta is up to age 23. The TAP program, sorry, that's up to age 23. In Manitoba, the supports to young adults grant is up to age 21, and there's also a AYA agreement with young adults up to age 26. And in Ontario, their Ready, Set, Go program that was established quite recently, I think about a year and a half or so ago, goes up to age 22. In Quebec, PQG goes until age 25, but again, this is not specific to youth in care. New Brunswick has a youth and young adults program that is currently being established as part of new legislation that came into effect in January of this year. So New Brunswick is actually kind of paving the way in terms of legislation in Canada, because they're the first province and territory to do this. So they established the Child and Youth Wellbeing Act, which is a new act that complements the Family Services Act, which is the act responsible for child protection services. And really what this act does is it modernizes certain aspects of the Family Services Act that pertain to child and youth well-being, including youth transitions from care. So they extended the age to up to age 25 through this legislation. And so the new youth and young adults program will support youth up until age 25. In PEI, there's currently a program called the YES program that supports young people up to the age of 21. There's also new legislation coming into effect quite soon. I believe it's in the coming weeks that's going to extend care as well. And in Nova Scotia, there is a program called the PATH program, and it supports young people up until the age of 24. However, all of these, not only do they have age cutoffs, but they also have restrictive eligibility criteria. So for example, in certain jurisdictions, they'll only support young people who came into care as permanent or placement to majority or permanent guardianship, or for example, in Ontario, the term is Crown Wards. And that only represents a very small percentage of youth who come into care. Some youth come into care as teenagers and they go on to agreements with the ministry instead of becoming full guardianship status. Some youth will come temporarily into care and kind of boomerang in and out to their home of origin, and then still end up aging out of the system. Those youth would not be eligible in most of the post-majority support programs that exist today across the country. And so the varying youth and care definitions in terms of eligibility really impacts on who gets to access this. There is also a study done in British Columbia by the Tyee a few years ago, looking at how many youth each year actually access any form of post-majority supports in BC, which is considered to be the province with the most supports available right now. And they found that only 1/3 of the cohort that left care every year was accessing any form of post-majority support. So that meant 2/3 were leaving care without accessing any supports at all. And a lot of the time, this is due to restrictive eligibility criteria, age cutoffs, but also sometimes young people are really not too keen on the system. Maybe they had a terrible experience with certain social workers or group home staff, or maybe their foster home placements didn't work out, and they really don't want to have anything to do with the system because of that. And oftentimes they'll opt out of certain supports and services just because it's being offered by the government, because they don't want to continue being over surveilled in that way. But then later on, they kind of regret that decision because they realize that they needed help. And right now, the way things are legislated and in policies, there's no option to come back. Usually when case files are closed, they're closed permanently. So that's another thing that's just inconsistent across the country. So I want to talk a little bit about the projects that I'm currently leading alongside the National Council of Youth and Care Advocates with the support of the Child Welfare League of Canada. We developed together the equitable standards for transitions to adulthood for youth in care. So I want to back up a little bit and give you kind of a sense of how this all started. So at the beginning of the pandemic, in March 2020, myself and a lot of other former youth in care who are doing advocacy in their home province and territory across the country, and a couple of key allies like the Away Home Canada, as well as the Child Welfare League of Canada, we got together virtually and really out of concern for young people who had to leave care during the pandemic because there were public health measures being announced by Health Canada, as well as CERB and all of that, but there's really wasn't anything being announced by the various provincial and territorial governments when it came to youth leaving care. And we were really concerned that young people were still leaving care as usual in such challenging and even dangerous times. So we advocated together for moratoriums on aging out, so to allow young people to kind of shelter in place, stay in their placements, and receive services and supports as usual until the end of the pandemic or until the end determined by the moratorium. And we did a lot of media interviews, press releases, opinion pieces, letters to ministers, and we were successful in getting moratoriums implemented in most jurisdictions in Canada. So once we were successful in that, we kind of sat down together and said, okay, well, what happens when these moratoriums expire? Because they all had expiration dates, or what happens when it's determined that the pandemic is over and we're returning back to normal? Do we go back to the status quo in the way that things were pre-pandemic? Because we know from all the studies that have been done in Canada on aging out of care outcomes that the status quo and how things have always been isn't working for young people, and something significant needs to happen in terms of change to the system. So this is why we decided to develop these equitable standards for transitions to adulthood for youth in care, because A, they don't exist in Canada, and each province and territory actually doesn't necessarily have any standards for transitions from care either. And we wanted to establish kind of a national standard that each jurisdiction could undertake and commit to, so that really long-term our vision is A, young people don't age out of the system, they leave the system and transition to adulthood, a true transition based on their readiness and not just an arbitrary age cutoff. And B, no matter where a young person lives in Canada, they're guaranteed a same level of support and services as any other youth in any other region would. So that was really the basis behind that. We had also done a scan of the literature, the grade literature. So that means like any non-academic reports, reports that were released by child and youth advocates, youth and care networks, and community-based organizations since the late 80s on aging out of care recommendations. And this was 2019 that we did that scan, and we found at the time, and there's more since then for sure, 75 reports with over 435 recommendations. And what we did is we scanned the most recurring recommendations out of those 435, and one of those was the lack of national standards for transitions to adulthood for youth in care. So that was also the impetus for us to really focus our attention on this and provide a longer term solution to transitions from care in Canada. So the reason why we embedded equitable into the word standard is because this is really what it's all about. It's about setting a high bar for young people in and from care because they don't have equitable opportunities and equitable supports currently. So we really have to go above and beyond for them so that they're able to succeed and thrive and achieve outcomes that are similar to young people in the general population. So in order to do that, you really have to focus on equity. So it also recognizes that one size fits all doesn't really work with young people who are disadvantaged and marginalized. So you can't be providing necessarily the same umbrella supports to everyone because it doesn't elevate them all to the same level or standard. So you really have to meet young people where they're at and recognize that each of them has different life circumstances, different needs, and really allocate the exact supports and resources and opportunities that that particular young person needs. The implementation of the standards has also to be done within a trauma-informed approach. So that's really at the core of these standards because youth in care live with various forms of trauma based on their previous experience before entering care. Many of them are victims of abuse, of various forms of abuse. And these forms of trauma can manifest in different ways during their time in care. And also the time in care can also be causing trauma as well. So for example, some exhibiting traumatic behaviors can be the inability to seek out and accept help. So internalizing and shutting down. And I think that's so important to any supports for care leavers is that the door has to always be left open for them to return should they need help, because it might be a defense mechanism for them to shut down and not want to collaborate, not want to accept services because they have such a mistrust in the system and a mistrust in adult authority figures. And rightfully so, because the whole reason why they entered care in the first place was because adults they trusted let them down and abused them. So that's something that has to be considered, and really you shouldn't shut any doors when it comes to supporting young people in care, and you should always stand ready to support them when they're ready to come back on their own. So in terms of the equitable standards, we developed them across 8 transition to adulthood pillars. So this is kind of a culmination of the research, because I did my PhD on youth leaving care, and as well as what the current youth in care community is saying that they need to be supported in order to thrive. So those pillars are financial, educational, and professional development, housing, relationships, culture and spirituality, health and well-being, advocacy and rights, and emerging adulthood development. And what we mean by emerging adulthood development is that period between 19 and 29, where in the literature, this is a period of exploration, a true transition period between adolescence and adulthood, where you're learning how to problem solve, learning your identity and what you want to contribute to society. And it's truly a phase of trial and error for young people in the general population. And because of what we know about young people aging out of care, because of the age cutoffs, they don't get to experience this developmental phase at all. And so we want that to be a guaranteed support where they get to experience that developmental phase as they transition to adulthood, and that the transition is a true transition and not a throw off a cliff, really, which is kind of what it is right now. And so we validated these pillars as well as the standards with young people who were still in care at the time of the development of this in 2021. And people who had recently aged out of care through our members of the National Council to make sure that what we were publishing truly reflected the pulse of the youth in care community across the country. So the equitable standards, I'm not going to read them all to you. I'll pick a few here and there just to kind of illustrate, but they're really rights-based statements that we developed together to really say this should be the standard for what youth in care are guaranteed to have a right to before they fully transition to adulthood. So for example, the financial pillar The standard is that every young person should have the financial resources required to meet their needs. Youth in care deserve to have a financial starting point that is above the poverty line and allows them to pursue their career interests and dreams. And as we talked about a bit earlier, youth in care tend to start their adult lives below the poverty line because they don't have that safety net of people that they can rely on. They can't call mom and dad and say, hey, I'm a little bit short on rent this month. Can you help me out? Or I don't have groceries. Can you give me a couple bucks so I can, go feed myself? They don't have that support system. And so when they enter a crisis, it's a huge crisis. And sometimes it's a crisis that they won't be able to get themselves out of quickly, and sometimes not ever if they don't have people rallying around them to help them overcome that crisis. So this is something we believe is really important. We also really advocate for guaranteed basic income as well. We know that that's something being discussed in Parliament right now. NDP MP Leah Gazan from Winnipeg Centre is really advocating for that, and we fully support that, and especially as it comes to youth in care, because they need that extra time to stabilize, to heal, to figure out what their talents are, what their interests are, so that they can pursue the other aspects of their development, like education and professional development. Another standard is the housing one. Every young person should have a place they can call home without strict rules and conditions to abide by. And what we mean by that is strict rules that are over what like a normal young person in the general population would be expected to abide by through rental agreements and things like that. Because what happens when programs and special housing is created, like transitional housing for young people in care, it often entails the continuation of the institutionalization of young people. So they're still kind of in care and over surveilled, and they have all these strict regulations and rules that are often setting them up to fail, really, and getting them kicked out of these types of programs. So each pillar and each standard is accompanied by a list of key supports, and these key supports are really actionable checklist items to ensure that stakeholders who work with young people in infirm care are able to meet the outlined standards, and these have also been defined by and for youth in care as well. And I just want to quickly show you what the key supports for the housing pillar look like. There's a checklist of 21 of them. I didn't include them all here, but you can go in the documents. I'll provide you with a link later where you can read all of the pillars and the key supports. So for example, Housing First for Youth in Care program based on Away Homes, Canada's best practice program, having animal-friendly housing. That's something that's a huge barrier, especially young people from care, where it's the only really first time they're able to get unconditional love is through an animal companion. And sometimes they get put in a hard place where they have to decide if they're going to have a roof over their head or choose living on the street. Most of them will choose actually living on the street with their animal because it's a family member to them. So we really want to eliminate that practice. Having youth choice in housing options so that they're not getting crumbs and living in dangerous neighborhoods or dangerous situations. Having tenants' rights training, so knowing their rights. Oftentimes, most young people from care get their first apartments and they have no idea what their rights are and often get taken advantage of. Having co-signatories and or reference for rental agreements. Again, they don't have that parent, they don't have that support network to do that. So having the ministry take that on or the agency take that on is really important. Luggage, like Varda mentioned, the garbage bags, that's just inhumane and really not acceptable. The standard needs to be upped way high, and they need to have luggage to be able to not only move out with, but to travel, and they need to have opportunities for travel. Having supports to go view apartments, that is also something that's missing for them to be able to choose a nice place to live without, being taken advantage of. Moving and housing setup costs being covered, and also access to training on healthy living skills and creating a safe space at home. So for example, like how to set boundaries with roommates and guests, how to communicate with your landlord, and so on. And right now we are currently doing a pilot of the evaluation model that we developed for the equitable standards. We currently have 12 pilot partners from across the country, in 6 provinces and 1 territory. As you can see in this map, that information is also up on the website. And it includes 3 government child protection ministries, which are PEI, New Brunswick, and the Northwest Territories, and 9 community-based agencies. So we're really looking forward to finalizing the pilot phase at the end of this year. And I just wanted to share one quote from one of our pilot partners from government regarding the equitable standards and the evaluation model. They said, "This experience gave us the opportunity to self-reflect and look at our current practice and how we deliver services to youth in care. Looking at it from the lens of those with lived experience brought a new perspective on how we could enhance our way in working so that we can better meet their needs. The evaluation model illustrated the importance of partnering with youth in care and ensuring that they have a voice throughout the process. I appreciated how the evaluation model broke down the needs of youth in care in pillars, which in my opinion consists of the areas which we as an organization should focus our work on with children and youth in care to set them up for success when they transition out of care." And another one of our government pilot partners said, "If you're not doing this, you're not truly reforming a system." So I'm going to just provide the link tree here for all our resources regarding the equitable standards, as well as a QR code. This will be available on demand as well afterwards if you don't have the time to look it up, but that's where all the resources about the equitable standards are. So thank you so much for being here and paying attention. And we're going to open it up for questions. Let me take a look here. Okay, so I guess maybe I'll ask a question to Varda. Why do you think Canada doesn't have national legislation or regulations in place when it comes to care leaving compared to what other countries are doing? Like, what's the reason for that? And how could it get implemented?
I'm chuckling. I want to point out, I don't know how many people in the audience might be aware of this, but Canada has a pretty abysmal record in relation to child rights generally. Canada was a signatory on the UN Convention of the Rights of the Child, which by now is 20 years old, Melanie. And when the UN came up with a convention on children's rights and got countries to sign off, there was an evaluation process involved. And so Canada has been evaluated several times now and has an abysmal report card from. So our level of, I think there's 2 problems. I think the level, we live in a context where a lot of things are delegated to the provinces, and child welfare has always been a provincial responsibility. And the federal government has not involved itself in creating any kind of national frameworks, not only around children in care, but children in general. And that's a very, very big problem. And you may be aware there is a senator from, I think she's from the Maritime, Senator Moody, who is trying very hard to involve the Senate in creating national standards for children in Canada. So I think it's a combination of it being a very decentralized system, of these powers being traditionally dominated by the provinces, and of a lack of federal engagement with children's issues. And the other problem is, in every country where there is federal legislation, for example, in the US, there's also federal funding that accompanies it. So standards aren't enough. There has to be money. And I think as Canadians, we really have to pressure our governments and use elections as opportunity. I don't think I've ever heard a federal politician talk about young people, and certainly not talk about young people in care. So I think it's a matter of all of us pushing together and pushing the government to see this as an important priority. I don't know if I hope that answers the question.
Yeah, I was part of consultations with Senator Moody when they were doing kind of nationwide consultations and talked about the need for standards for youth in care as well. And I know they were looking at potentially advocating for like a national ombudsman or child and youth advocate for youth in general, because that doesn't exist at the federal level. And
can I just
go
throw
ahead.
in one other statement,
Yep.
which is I think the other thing that's made a huge difference in Argentina, for example, or the UK, or even Germany, where these things are recently happening, has been a very strong voice for former youth from care. So your national advocates group is going to be a key group, Melanie, in pushing this forward, because anywhere this has been successful, in the US as well, one of the things that people have talked about at these INTRAC meetings is it's when the young people went to the legislatures themselves, that's when the government started to listen. So
yeah.
sorry,
and we also need champions. We need champions within Parliament and within the Senate. That's really important. And we do have a few who have been bringing this up. For example, Senator Moody. There's also Senator Wanda Bernard, who's also from the Maritimes, who has specifically asked questions regarding aging out of care and has asked to launch a study on aging out of care in Canada, and has been communicating with us about that. There's also, like I mentioned earlier, MP Leah Gazan from Winnipeg Centre advocating for universal basic income, and she very much cares about youth and care issues as well. So we need more of these people on our side to be able to advocate for all the multiple supports and services that young people need from care as they transition to adulthood. So I guess I'll ask a question maybe for both Laurence and Varda. What do you think are some of the key topics of research on care leaving in Canada that are currently underexplored?
Laurence, you want to give that a go?
Oh no, go ahead. I'm curious what you have to say about that.
Well, I have to say, I feel very strongly that, first of all, research in Canada is on the increase, but it's still in its infancy. I think the first thing is we don't even know clearly how many young people are in care in Canada and how many young people in Canada are aging out of care. So we don't have a database. We have no national system of collecting statistics. So it's hard to do research because we're lacking basic information. The other thing that I want to say is I think the research that has been done to date has focused a lot on the problems of young people leaving care. And I don't think I think we know that young people leaving care have problems, but continuing to do research that focuses only on the problems contributes to stigmatizing them. I think what we really need to be looking at is outcomes in relation to services and supports that exist. We need to be shifting the focus from looking at them as a special population and owning that this is a systems problem and that the research has to document those systems problems. So I feel very strongly about that. Laurence, do you want to add?
I wanted to add that actually Varda and I are working on a scoping review to kind of map the research that is existing on care leaving in Canada, because actually we don't know, there's no way to know what exists. So maybe for next webinar.
Yeah, I think that's something that can be, CANTRAC can grow too, right? Because we don't know all the researchers who are involved in Canada on care leaving. But yeah, Varda, you're right. We don't have a national database like the US does, for example, and they are rich in data and studies that come from that. Unfortunately, we don't have that. And even the administrative systems within the various provinces and territories aren't modernized enough to be able to use that data. And data oftentimes stops getting collected as soon as they age out. So the file gets closed and you don't know what happens to the youth from an administrative data standpoint. So we're definitely at a disadvantage when it comes to data in Canada. I also think the research needs to be focused on solutions, not just pointing issues, whether it's systemic or population wise. I think and the solutions need to come from the people with lived experience. That's really what I tend to center my research projects on, is really that has to come directly from the people who have lived it, because they're the experts, really, and they need to be at the table when decisions are being made, whether it's like to introduce new legislation or new programs, or to reform existing systems and laws and legislation. They need to be at the table, and that's not happening enough in the context of Canada. And I think that's why we're not seeing the outcomes that we want, because you're missing the boat when you don't have the people with lived experience at the table. So I think, to me, that's part of the future of what research should look like, is getting young people to come up with the solutions. They just need to be provided with the opportunity and the platform to do so.
Melanie, I have a quick question to ask you for our audience
Sure.
here today. What do you think that frontline social workers can do to try to help all of us move forward with this?
Oh, that's a big question, but there's a lot that can be done. I think, making sure that you're taking trauma-informed practice training. If that doesn't exist, advocating in your agency to get that to happen. But I think even like from day to day is like, just treat the person in front of you, the youth in front of you, as a human being instead of a case file number. Like, they're a human being with dreams and hopes and strengths. Ask them about that. Don't just treat them as a problem or a crisis to be resolved, because they internalize that as they grow up and as they move on, and they think that they're not worthy of anything. And we really need to change that. We really need to adopt more strength-based approaches when it comes to youth in care, so that they leave care feeling like they have value and they have potential, and that it's fully invested in. So I would say that just treat the person in front of you like a human being. And if you have kids, treat them like you would treat your own kids. So I think we're over by 1 minute, so I'll just wrap it up. Thank you so much, everyone, for attending the first webinar of the series. And hopefully we'll see you at the next one, I think on October 3rd. Is that the date?
October 2nd.
October 2nd at the same time. So thank you so much. And again, this webinar will be available on demand afterwards. Have a great day, everybody.